about vaccines this year. Will we still be talking about vaccines next year?
Well, let's hope not. Let's hope that the rollout has run its course by this time next year and we've achieved some sort of stability when it comes to this. But the key thing is the rate, guys. The rate is really concerning. William Kize was part of a webinar yesterday talking about the rate at which we're going to roll out these vaccines. Business executives were also involved. They're saying that it's possible for us to really ramp things up when we have the vaccines in hand. But we just wanted to get some perspective in terms of the rollout for health workers and how quickly that's happening. So let's focus on the climb to vaccination, if you want to put it that way. By the end of February, after those first 2 weeks, we had vaccinated just under 71,000 health workers. As you mentioned, that's great, that's very important. But William Kize said the target for the end of March was 1.1 million people. Again, that sounds fantastic as well, but we did the calculation. That translates to 33,200 health workers per day on average that will have to be vaccinated. The highest that we've reached in a single day so far is about 11,000 health workers. So if we want to achieve that target of 1.1 million, we're really going to have to ramp things up, and we're going to have to do it very, very quickly. We're really going to have to make sure that we've got our systems in place and that we can do this pretty fast.
I know you've also been looking at the UK and Israel. I mean, they got into it pretty quickly, didn't they? So what does it teach us?
Yeah. And the key takeaway from that, Jane, is that you can ramp things up very quickly, provided you have done the preparation. I spoke to an academic yesterday and asked him what we can take away from the UK and Israel, and he said preparation, preparation, preparation. So they had already been planning their vaccination sites long before they even got the vaccine. So that's an important lesson. But let's focus, first of all, on Israel, and you'll see how these numbers jump, guys, from day to day and from week to week. Just a note, when you see those dips, that's largely because it reflects the weekend. So people tend to get vaccinated a little bit less during the weekends. But take a look at that. On the 20th of December, when Israel started its vaccination program, 7,400 people got vaccinated. By the end of the year, so we're talking 11 days later, 160,000 people in a single day. These are all figures in a single day. It spiked, guys, on the 21st of January. So we're talking a 3-week period, 230,000 people in a single day. And it's now starting to taper off because Israel has managed to vaccinate large sections of its population, especially those critical, vulnerable populations like the elderly and those with comorbidities. But one of the latest figures, still 160,000 in a single day. And remember, we're talking just over 2 months since it started, and that was 7,400 in a single day. Let's also focus on the UK just as we wrap things up, guys. And again, you'll see massive spikes, massive ramping up in terms of the numbers. The 11th or 15th of January, just under 350,000 people in the space of 24 hours. The 23rd of January, so a week later, guys, almost 500,000 Brits managed to get the jab, and it went even higher a week later, 610,000. So you get the picture at how they managed to ramp things up very, very quickly, and they've managed to maintain that. As I mentioned, some of those dips are related to the weekends, but they've managed to maintain it. 26th of February, the latest number, 537,000 jabs. So a lot of lessons that we can take from these countries. The key thing, we need to have the vaccines in place. We need everyone trained and ready to put them in people's shoulders.